I'm Dr. Cliff Robertson. I'm the president and CEO of St. Francis Health System, and we're pleased to be partnering with DispatchHealth, a company that has really innovated on a care delivery model that is now being deployed around the country, and we wanted to ensure that our community members, folks that live in and around Tulsa like we do, have access to another level of home-based care. So we're really excited about this, and we really believe that this is part of the future of healthcare, which is being able to deliver more care at home, where it's not only efficient for the patient or the individual, but quite frankly, it's what we really all want. Part of my bias is that I'm a family doc by training, and what I learned many years ago, that the best healthcare that we can deliver is healthcare that's as close to home as possible. And in this case, we're going to be delivering care actually in the home, and we're excited to be able to offer this to the community.
So what is St. Francis putting into this? It sounds like you're putting all the equipment, the trucks, and all that stuff. So
well, so there's a startup investment to be able to staff up the cars and the staff, and so St. Francis is a financial partner to Dispatch to be able to bring them to this community. We will benefit from it because we every day have patients that are trying to access care in our emergency departments that just can't because there's so much demand. And as a family physician, we know that there are a certain number of patients that will come to our emergency departments that really had a condition that could have been cared for in a different manner. So as you've seen, we've built urgent care, bricks and mortar urgent care clinics around the community. We also offer virtual urgent care for people that a telemedicine visit would be appropriate. But there's a level of care that is in between what telemedicine can deliver and what you might need in an urgent care and emergency room. And our partner Dispatch will help us deliver that level of care in this community as well.
We were talking earlier with several of the teams, and very impressive that St. Francis is actually very forward-thinking in bringing in DispatchHealth. We find ourselves mostly in football towns, but really being that forward-thinking and that progressive to bring in DispatchHealth as a partner, to really be an extension of the care that they provide in the hospital. So DispatchHealth's goal is to be the largest in-home system of care in the country. And so much to that end, St. Francis has brought us in to help them with that. The Rover vehicle that we have, it's co-branded with St. Francis and DispatchHealth, actually comes equipped with an advanced practice provider. Now, this is an emergency medicine trained nurse practitioner or physician's assistant. Additionally, comes with a medic. Those teams come with multiple Pelican cases in the back, all addressed by system to address acute care needs for those patients that need care. From a diagnostic perspective, we have the ability to do a 12-lead EKG at home. We have the opportunity to bring in mobile imaging for patients who have issues getting out of the home. But the ability to treat patients with IV, IM, or PO antibiotics, IV, IM, or oral antiemetics, IV fluids, nebulizer treatments, IV steroids, wound care, lacerations, abscesses, boils, strains, sprains, contusions, and fractures, all within the comfort of their home for 30 to 45 minutes. Doesn't happen anywhere in medicine. And so bringing that power of 70% of what an ER does in the home is a very powerful experience for patients.